Hello, I'm Dr. Jim Coyle, and this tutorial in the Challenges in Human Behavior course is focusing on mental illness. First, consider what you already know about mental illness, what it looks like, what influences it, what we do about it. Jot down your initial ideas about this. Note that 1 in 5 Canadians will experience a mental health problem in a given year. 50% of Canadians will have or had a mental illness by the age of 40. 24% of deaths for 15 to 24-year-olds and 16% for 25 to 44-year-olds are from suicide. 21.4% of working Canadians currently experience mental health concerns. 10 to 20% of Canadian youth are affected by mental illness, and only 1 in 5 youth will receive the treatment that they need for it. And finally, 3.2 million Canadians aged 12 to 19 are at risk for developing depression. These statistics suggest that certainly mental illness is a life challenge that social workers need to be helping to address. Furthermore, men are more likely to be affected by substance misuse and antisocial personality, while women are more likely to experience depression, anxiety, eating disorders, or borderline personality. The highest rate of mental illness is for those between 15 and 24 years old. Unemployed people and newcomers have a higher prevalence of mental illness, but a lower usage of services. Mental illness refers to altered thinking, mood, or behavior associated with significant distress and impaired functioning. Risk factors for mental illness include a family history, age or sex, which is related to the specific types of mental illness that are more associated with men or women or at different ages, substance abuse, chronic diseases, family and workplace and life event stressors. There are many people that have talked about what this mental illness is all about, and some have been have questioned the validity of mental illness. Thomas Sass and the myth of mental illness has questioned whether our beliefs about mental illness become a symptom related to the illness, and how do we differentiate between a person who's observing what's going on and the person who's observed. Sass advocates that we look at mental illness afresh, remove it from the category of illnesses, and see it as an expression of man's struggle with the problem of how we should live. Another factor that people are questioning about mental illness is the stigma associated with it. Just half of Canadians would tell their friends or coworkers that they had a family member with a mental illness, while 72% would discuss physical illness diagnoses. Only 12% of Canadians said that they would hire a lawyer who had a mental illness, and only half said they would socialize with a friend with a serious mental illness. 46% of Canadians think that people use the term mental illness as an excuse for bad behavior. 27% are fearful from being around people who suffer from serious mental illness. Now, considering the previous statistics I just mentioned, it says that 50% of Canadians have or had mental illness by age of 40, consider the impact of this on people and how people who are dealing with mental illness are reacting to this kind of community concern. All these factors influence our own ideas about mental illness. It's not unusual for people to think of mental illness as being crazy for life, unable to manage life, lacking control, or being possibly violent. Mental illness, excuse me, Mental illness can be thought of as a lack of willpower or resulting from bad parenting. None of these things, of course, are true. And suggested reactions to these myths and to reactions about mental illness tend to use the mnemonic STOP. Stop stereotyping, stop trivializing people's health challenges, stop offending someone with your attitude, and stop patronizing that unconscious feeling that you're better than they are. There are a wide range of theories explaining mental illness. Biological theories tend to focus on genetics and chemical imbalances. Psychological theories focus on the psychodynamic conflicts and the cognitive behavioral influences. Social theories such as social constructionist and critical disability emphasize how the community and society impacts on people's personal lives. While multiple causation theories such as stress and vulnerability model and biopsychosocial models use a more ecological approach to suggest that mental illness is influenced by multiple domains, multiple levels of influence. Mental illness is defined in the Diagnostic and Statistical Manual of Mental Disorders. This is a book published by the American Psychiatric Association. It's the basis for psychiatric and mental illness diagnosis in North America. It's important to notice that it was created as an assessment tool for assessment, and that diagnostic categories suggest treatment methods, but those treatment methods are published in other places. Things to consider about the DSM is it was created by consensus, not exactly created by the results of empirical research. It is written by people who are primarily white, Western, and male. The diagnosis is by the number of symptoms that are noticed, but there is a subjective judgment about how those symptoms are seen and defined. Is it political? Many people think that it is. It certainly is medically focused in terms of that this is something published by psychiatrists who are medical doctors. And so the biological and medical model is used to define mental illness. There's a wide range of categories of mental illness, and very simplistically, we can think of them as thought disorders, such as schizophrenia and other psychiatric disorders, mood disorders, bipolar, depressive, anxiety disorders, obsessive compulsive disorders, trauma disorders, such as acute stress disorder, post-traumatic stress disorder, dissociative disorders, neurodevelopmental and neurocognitive disorders, which we kind of see mostly in our children, such as attention deficit hyperactive disorder, and in older adults, such as dementia, but can occur in different places depending upon the illness, the disorder. Substance-related and addictive disorders, so alcoholism and opioid use and cocaine use and all kinds of substance uses are also defined in the DSM. Disorders related to physical symptoms, so somatic disorders, feeding and eating disorders such as bulimia and anorexia nervosa, elimination disorders, sleep-wake disorders. One of the groups in our class is focusing their assignments on insomnia. Sexual disorders, such as sexual dysfunctions, which are difficulties in sexual performance, such as erectile dysfunction or pain during intercourse, or disorders related to sexual desire. Paraphilic disorders and gender dysphoria are controversial because many people say that these attribute mental illness to variations in sexual expression that are that really are a normal in the normal range of sexual expression. Disruptive impulse control and conduct disorders are often used with acting out children and teens. And so there's some discussion about whether medicalizing or kind of making this a mental illness is a good thing, so it can be focused on that way and with treatment, or whether that's a bad thing because it suggests that it's not being influenced by things like community factors, parenting, other emotional factors that are going on in the home or at school. Personality disorders, which I'm going to mention a little bit further on the next slide, as well as medication-induced disorders and disorders that they do not attribute to mental illness, but acknowledge require clinical attention, such as relationship problems, family issues, work issues. Personality disorders are an enduring pattern of inner experience and behavior that deviates markedly from what we expect. The pattern is inflexible and pervasive across all areas of the person's life. Without going into details, the personality disorders have been divided into 3 clusters depending upon how these symptoms tend to come across. So in cluster A are people who come across as odd or eccentric, such as paranoid, schizoid, or schizotypal. The cluster B, the dramatic or emotional reactiveness that comes in an antisocial, borderline, histrionic, or narcissistic personality, as well as in the third, anxious, fearful, that comes with avoidant, dependent, or obsessive compulsive personality. Consider how you've learned about mental illness diagnostic categories. What have your experiences been? Some of them may be experience from your personal life. Some of them may be from professional, working with clients. Many times what we learn about mental illness comes from media. And I suggest that you look at this music video and someone discussing mental illness in the movies, as well as a documentary about a young man who has been diagnosed with psychosis. I've put these links in the comments. But as you watch these videos, kind of takes down some notes about what your reaction is to them. What do they tell you about mental illness and about your own feelings about mental illness? Jot down your ideas about the DSM-5, how it may be helpful, how it may be problematic, how social workers use or should not use the DSM-5 categories. As in the past, these notes can help you in an in-class exercise where we're going to focus on how do social workers assess and support and educate, as well as help people affected by mental illness, and so that we can have some discussion about that. Notice what you have learned, what may be factors of mental illness that you haven't thought about before in this tutorial or in the reading or in the videos that I've suggested. What will you talk about in class? What will you bring in so that we can talk as a group about this? And how will that influence what you say in your small group about helping clients? I look forward to having this discussion with you.